continue our tour of SOVAH Health throughout Southside. I tell you what, I love telling you about all the great people at SOVAH Health. And I've got another great doctor here. Go ahead and introduce yourself.
Hi, good afternoon, everyone. My name is Sukhdeep Singh Bogal. I'm one of the intervention cardiologists at SOVAH Health, Martinsville, and I have joined here back in August. And I have come from Washington D.C., where I did my interventional training, and I was there for 2 years. And then previously I did my cardiology in Johnson City, Tennessee. So I was very familiar with the population of the area and in the south part of the United States. And this is my first job, so I'm here for last couple of months and enjoying it so far.
Oh, you bet, man. Nothing like Southside Virginia, I tell you what. All right.
No, so far I'm liking it. It's been,
yeah. Back behind you, I love this. We have it's not a Christmas tree. It looks like, at the first glance, it looks like a Christmas tree, but it's a heart tree.
Yeah. And
we're celebrating American Heart Month all month long.
Yeah.
And I mean, this has got to be your month, right?
Yeah. We have been, this is February, what we call is like American Heart Month.
Mm-hmm.
And actually, they have started celebrating it back in 1964
mm-hmm.
to increase the awareness of heart diseases, and particularly in women. And the reason we are celebrating the American Heart Month is to increase the awareness. And the awareness, what we usually talk about is not to ignore the common things and adapt a healthy lifestyle for the patients.
Mm-hmm.
So what I mean from that is, like, we can make small changes in our daily routine, like doing physical activity. What American Heart Association usually recommends is like
move around more, right?
Move around more, and like doing physical activity like 150 minutes in a week.
Say that one more time.
150 minutes in a week.
Okay.
Or we can do like 30 minutes
mm-hmm.
in a day for at least 5 days in a week.
Okay.
That's what American Heart Association recommends. And we can also do like healthy eating, like eating more vegetables, less salt in our diet, and making sure we are not indulging in activities like smoking and alcohol consumptions, because all these things have been known to increase the risk of heart disease. And how we can make our communities like healthier is making the lifestyle changes, which is the basic thing and most important thing to decrease the incidence of heart disease in our population.
All right.
Yeah.
I'll tell you what, after I've been focused on this, I've been thinking about it. I've been going up, I have some steps at work. I try to go up and down at least 10 times. Are steps good?
Yeah. Like just taking a flight of stairs every day, it also like have been shown to do like help and decrease the incidence of heart disease in the patients as compared to the patient who doesn't do any physical activity at all.
Right.
So yeah, these small things and adapting a healthy lifestyle is the most important thing. And the other thing I want to talk is like not ignore your symptoms, So if someone has a heart disease, they need to see the heart doctor for sure. Okay.
Yeah.
And if someone does not,
men don't go to the doctor.
Yeah. And we see that very common in our patients, like they are presenting with their heart attacks a day or two later.
Yeah.
So we should be aware like how the heart disease present, and the most important symptom is chest pain.
Mm-hmm.
And men usually may present more with like when they are doing something, And women, what we have seen is the symptoms are mostly atypical, and they can have like shortness of breath, they can have chest pain at rest, they can have palpitations. So, and if you have not had these symptoms before, and this is something is bothering you now, so you should see a cardiologist and make sure your heart.
It's like an alarm in your head.
Yeah. So we should not ignore these things.
Right.
And also, I would also like have my have one of my messages like make sure your blood pressure and your cholesterol is well controlled, because I see so many patients in our community, their blood pressure have been uncontrolled, and then one day they present with a stroke, heart attack. So controlling the blood pressure is very important step. And as you know, like most of us as families to have high blood pressure and high cholesterol. So making sure having healthy lifestyle and checking your blood pressure regularly, following up with your primary care regularly. Those are at least once in a year if you are not following with them with regularly. So these are very important steps to make our community more healthier.
All right. This is the month to do it.
Yeah.
Because you're thinking about it. It's on our head. That's why we call it Heart Month, because we want to keep this in your focus. So the best thing you said, if you have a symptom, you feel pain, address it.
Yes. If you have pain, if you have symptoms, don't ignore it. At least get yourself checked up.
Yeah.
And if you don't have anything, at least start working on your healthy lifestyle and doing more physical activity. Just walk around your neighborhood, do like a brisk walk every day, make it a habit. And these are the small things you can adapt in your lifestyle, and that will like make you live healthier and longer life.
Perfect. Thank you so much.
Yeah, no problem.
Thank
you.
All right, man.
Thanks.
So much going on at SOVAH Health. I tell you what, stay tuned to Star News. We're going to be showing you more great people of this great company. Stay with us.